Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about diabetic ketoacidosis. So let's get into it. So the first thing I wanted to do was remind you of how the body is supposed to work normally. So you have glucose is what we use to give us energy, so that's sugar. And then we have insulin. The job of insulin is to help get glucose into the cells so that it can be turned into energy. So that's how it should work normally. In diabetic ketoacidosis, there's a problem. So you either have very little amounts of insulin or no insulin at all. And because of that, it can't do its job. So the glucose cannot get used correctly. It does not get taken into the cell. What does it do? It floats around in the bloodstream. And the body doesn't recognize that. It's like, where's the glucose? What's going on? Oh no, we don't have enough. We need to do something about it. And then it thinks of a little solution that ends up making things worse. So what happens once it freaks out and realizes like, oh no, where's the glucose? We can't find it. It says, you know what I'm going to do? I'm going to start breaking down some fat. And we're going to use that fat as energy until we can get this glucose situation straightened out. When we break down fat, something called ketones are released. Ketones are the byproduct of fat breakdown. And maybe you're starting to see this. Ketoacidosis, ketones, that's what that means. So ketones are the byproduct of fat breakdown. And if enough of them build up in the bloodstream, it can make our blood more acidic. So it can put the patient into something called metabolic acidosis. And metabolic acidosis, if we don't do anything about it, can lead to death. So diabetic ketoacidosis, keto like ketones, acidosis like metabolic acidosis, this is very, very dangerous. This is a life-threatening thing that we do not want to happen. Now let's talk about the causes and the risk factors for developing diabetic ketoacidosis. So a way you can remember the causes is the 8 I's. So all of these I words, let's break them down. So the first is infection. So it could be like pneumonia or UTI. Infarction, like a myocardial infarction, like a heart attack. Infant, so this is more likely to happen to a pregnant woman. Infraction, so the patient is non-compliant with their insulin therapy. Ischemic, so something like a stroke. Illegal, so using illegal substances like cocaine. Iatrogenic, so an adverse effect of a medication the patient is currently taking. So we weren't expecting this to happen, but it happened. And then idiopathic, new onset diabetes or some other condition. And as you'll note, the risk factors are related to these. So the biggest one, the biggest risk factor for getting diabetic ketoacidosis is having type 1 diabetes. Now, can this happen to you if you don't have type 1 diabetes? Yeah, it can. But this is the biggest group it happens to. These are the people we need to watch the closest. Not using your insulin correctly. So that is related to this one. So either non-compliance or maybe the patient just doesn't know. Maybe they've missed a dose. Maybe they're doing that on purpose. They're spacing out their insulin because it's so expensive, so they're not taking it as prescribed. Maybe they're using expired insulin, right? So things like that we need to investigate because that can cause diabetic ketoacidosis. Having an infection, like we talked about, and heart conditions, like we already talked about, like a heart attack. So these are the causes and risk factors for developing diabetic ketoacidosis. Now let's talk about the signs and symptoms. And as we go through the signs and symptoms, I want to see if we can make a connection between the other things that are happening in the body. So the metabolic acidosis and the hyperglycemia, so those very high levels of blood glucose. So polyuria and polydipsia, those are of course very classic signs of hyperglycemia. So polyuria, frequent urination, and polydipsia, very, very thirsty, excessive thirst. They'll have a dry mouth and dry skin. They might appear confused or fatigued. which happens in acidosis. They might have sweet smelling breath, or sometimes they call this fruity smelling breath, like you can smell the sugar on their breath. Kussmaul's breathing. They may have shortness of breath and muscle aches. How is this diagnosed? Well, the first thing we're going to do is take a blood sugar, right? Because in diabetic ketoacidosis, you have very high blood sugars. So it will be greater than 250. We're also going to take a blood pH. It will be less than 7.3, so it'll be acidic. We'll probably do a UA and take some blood, and we will notice ketones present in the urine and blood. And they also might want to do a chest x-ray or an ECG just to check your heart out, because a lot of times it can be caused by heart problems, like we talked about, a myocardial infarction, things like that. So they might want to do a chest x-ray or an ECG as well. A way you can remember the treatment for diabetic ketoacidosis is KING-FM. So the K stands for potassium, and what we need to do is monitor their potassium levels. In diabetic ketoacidosis, they can have very low potassium levels, which can be very dangerous. This is another reason why when we do our diagnoses, we're going to do an ECG. Okay, so that's going to affect our heart rhythm, right? Having low potassium will affect our heart rhythm, so that's something they're going to want to monitor for. So monitoring potassium levels. Of course, insulin, right? That's the problem. The lack of insulin, or not enough insulin. So we're going to be giving insulin. And instruction about the insulin. One of the reasons somebody can get into DKA is non-compliance with their medication regimen. So instruction about how to use insulin appropriately, taking it as prescribed, don't use expired insulin, things like that is going to be really important to teach your patient. If they are in a coma, which can happen sometimes, an NG tube might need to be placed. Of course, glucose monitoring. We want to know what's their glucose when they came in and what is their glucose now that they're receiving treatment. Hopefully it's going down, right? Hopefully we're getting it into a normal, healthy range and the patient is doing better. But we're not going to know that unless we keep an eye on it. So glucose monitoring is very important. Fluids, IV, so giving IV fluids because metabolic acidosis causes fluid and electrolyte imbalances in the body, and we need to fix those. So giving IV fluids. And then M is for monitoring I&O, so their input, their output. Typically these patients will get an indwelling Foley catheter placed by the nurse so that we can get strict I&O on them. And then also monitoring their creatinine levels. So we want to make sure that this is not starting to affect the other organs in the body. When you have metabolic acidosis, right, you have issues with your kidneys. Your kidneys are not functioning well. So this is going to kind of be an indicator on how well are the kidneys functioning. Are they improving with the treatment that the patient is receiving? And hopefully they are, right? That's the goal. That's what we want. So that was my video on diabetic ketoacidosis. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.